A 55-year-old client presents to clinic for a small slowly enlarging papular skin lesion on the right aspect of his nose that has been present for less than 6 months. The nurse is aware that sun-exposed skin is susceptible to lesions that may become cancerous. The appearance of the lesion is consistent with a basal cell carcinoma. What is the best initial treatment for this type of lesion? A. Ultraviolet radiation. B. No treatment is warranted at this time, the lesion should be observed for signs of overt changes. C. Radiation and systemic chemotherapy. D. Excisional surgery with possible use of topical chemotherapy agents. E. Wide excision of tissue down to fascia. The answer is D. Excisional surgery with possible use of topical chemotherapy agents. The proper intervention for a lesion on the nose should include complete excision of the lesion to send for biopsy to discover the extent and type of skin lesion. It may require additional treatment in the form of topical chemotherapy drugs or further surgery depending on the pathological findings. Wide excision to fascia may be reserved for more invasive skin cancers such as malignant melanoma after an initial biopsy has been performed. Lesions that have been present for longer than 6 months should be biopsied as a general rule, although some practitioners may biopsy sooner with increased suspicion of ominous-looking lesions. A nurse is caring for a client newly diagnosed with chronic lymphocytic leukemia, CLL. The nurse is aware that this type of malignancy is associated with certain factors and clinical manifestations. Which of these is not associated with CLL? A. The affected cells contain a distinctive genetic abnormality, known as the Philadelphia chromosome, used as a marker of the disease. B. Treatments mostly include combination therapy of various chemotherapy agents, as well as radiation and splenectomy. C. Some diagnostic findings include thrombocytopenia, with the presence of lymphocytes within the bone marrow. D. There is usually no symptoms seen in early disease, with later manifestations such as fatigue, and night sweats. E. CLL is the most common leukemia in adults, mostly affecting men between the ages of 50 to 70 years of age. The answer is A. The affected cells contain a distinctive genetic abnormality, known as the Philadelphia chromosome, used as a marker of the disease. The Philadelphia chromosome is associated with chronic myelogenous leukemia. A patient with a strong family history of cancer presents to your clinic with a new diagnosis of medullary thyroid cancer. You are concerned that the patient may have the familial cancer syndrome, MEN2A, multiple endocrine neoplasia, syndrome. Which of the following represents the malignancies encountered in MEN2A syndrome? A. Medullary thyroid cancer, pheochromocytoma, parathyroid adenoma. B. Medullary thyroid cancer, colorectal cancer, uterine cancer, gastric cancer. C. Medullary thyroid cancer, pheochromocytoma, mucosal adenoma. D. Medullary thyroid cancer, parathyroid adenoma, islet cell tumor of the pancreas. E. Medullary thyroid cancer, head and neck cancer, esophageal cancer, anal cancer. The answer is A. Medullary thyroid cancer, pheochromocytoma, parathyroid adenoma. These are the cancers most commonly associated with MEN2A, multiple endocrine neoplasia, syndrome, a familial cancer syndrome that predisposes to development of numerous cancers in patients generally at younger ages that would be expected. One should have an index of suspicion for such a familial cancer syndrome when evaluating a patient with a new cancer who has a family history of similar cancers that are known to be associated with familial cancer syndromes, Medullary thyroid cancer, pheochromocytoma, and mucosal adenomas are seen in patients with MEN2B syndrome, not MEN2A. Medullary thyroid cancer, parathyroid adenoma, and islet cell tumors of the pancreas are not seen together in a particular cancer syndrome. Parathyroid adenomas, islet cell tumors of the pancreas, and pituitary adenomas are seen in patients with MEN1 syndrome though. You are the nurse taking care of a 20-year-old patient who complains of palpitations, feelings of anxiety, headaches, and sweating for the last 2 months. You take the patient's vital signs, and find that they are tachycardic and hypertensive. Thyroid function tests and a urine drug screen are both within normal limits. 24-hour urine catecholamines and metanephrines are markedly elevated. Which of the following is the most likely diagnosis? A. Cocaine abuse. B. Amphetamine abuse. C. Generalized anxiety disorder. D. Pheochromocytoma. E. Panic attack. The answer is D. Pheochromocytoma. A pheochromocytoma is a rare neuroendocrine neoplasm that arises within the chromaffin cells of the adrenal medulla. Pheochromocytomas can secrete norepinephrine and norepinephrine, which can lead to symptoms of sympathetic activation. Patients with pheochromocytomas may experience palpitations, hypertension, headaches, fatigue, flushing, sweating, nausea, anxiety, and flank pain, among other symptoms. The workup for pheochromocytoma includes 24-hour urine catecholamines and metanephrines, as these would be elevated in a patient with a pheochromocytoma. For the patient in this vignette, he or she complains of a number of symptoms that are consistent with a pheochromocytoma, and the elevated 24-hour urine catecholamines and metanephrines has a high sensitivity and specificity for pheochromocytoma, so this is the most likely diagnosis. Panic attacks and generalized anxiety disorder may present with similar symptoms to a pheochromocytoma, but would not account for the elevated urine catecholamines and metanephrines. Amphetamine abuse and cocaine abuse may present with some similar symptoms to a pheochromocytoma, but would not account for the elevated urine catecholamines and metanephrines, and also would have appeared in the urine drug screen. The urine drug screen in this patient was within normal limits. What muscle pathology is often linked to small cell lung cancer? A. Duchenne muscular dystrophy. B. Lambert-Eaton syndrome. C. Rhabdomyosarcoma. D. Guillain-Barré syndrome. The answer is B. Lambert-Eaton syndrome. Approximately 60% of patients diagnosed with Lambert-Eaton syndrome have an underlying cancer, most often small cell lung cancer. Lambert-Eaton syndrome is an autoimmune disorder in which the release of neurotransmitter is not permitted due to antibodies against the presynaptic calcium channels. This results in muscle weakness in the limbs. The other conditions listed are not associated with any respiratory cancers.